Traditional CME involves the doctors really grabbing their certificates and points and just collecting their 50 credits per year. And the way the meeting's been going over the past few years, it's clear that CME is something more. And over the past few months, we've been discussing CME as an engine for managing change. And it's quite natural to call CME a change management engine. And we've been trying to work this theme through the sessions. We've asked the workshop leaders this year to look at CME and the topics that they're covering in the context of how it can affect change, whether it's performance or in change in kind of behaviour of their learners, which is essentially what we want to achieve within CME. This year we've had some great discussions between our main stakeholder groups, and a theme that keeps coming out session after session is just the topic of collaboration. How do people work within their own groups and with each other? And that's something that we're hearing more and more as the years progress, and especially this year. We've moved the meeting away from being in hotels and having them in academic institutes or in centres of learning, as we are this year at King's Fund. Next year we're going to the University of Manchester. We're already working on the programme and trying to get some kind of collaboration with a local organisation in Manchester, which will bring something really exciting to the meeting next year. Over the years, we focused on our 4 core stakeholder groups. So European CME Forum is for the medical societies, for the professional providers, the accreditation bodies and industry. Of course, recently we're seeing additional voices coming to the table, such as the patients and how they're involved in affecting change in clinical practice, for example, and also the learners. And this year, for the first time, we've even had medical students. So it's anyone with an interest in CME, clearly education for the specialists, the consultant level onwards, but the scene for this is evolving to include many more stakeholders.